few weeks back, I went to the doctor for a UTI. I gave them a urine sample. It was the only thing that I went into the doctor for. Guess how much that bill came out to? I got the bill today. The bill came to $331. I also gave them a $50 copay. What the fuck for? What the fuck is it all for? Somebody please tell me. And by the way, that's with insurance. America, we're number one.
Hello guys, welcome back to Inside Republic. On today's video, we'll be talking about health insurance. While people's trust in health insurance is crumbling as they pay every month only to be denied coverage, buried in unexpected bills, and left to fight alone when care is needed most. Kindly like and share this video, subscribe and follow for more videos like this. And to show us some extra love, you can send us some super thanks. We'll truly appreciate that. Now let's watch the following video clips.
Hi, hello. I have a quick question. This is for anybody that knows the in-depths of insurance, aka scam in the United States of America and our healthcare system. Is it legal for an insurance company to send you a letter in the mail saying this procedure, which your doctor has prescribed and wants to do, we have approved it, you're good to go? Is it then legal for them to, after the procedure is said and done, say, yeah, no, we're not covering it, so sorry? Can somebody answer that for me?
Hi. Can someone who is smarter than me please explain how a medical professional can think you need a medication and prescribe you that medication, and then your insurance that you pay over $14,000 a year for can turn around and say, we don't really think you need it, so we're not going to cover it. And you're a working middle class family, so you can't afford for it to not be covered and still take it, so you just don't take it. And it's I feel like that's not great, why is it like that? Why does insurance suck? Why does the healthcare system suck? And is there anything I can really do about it? No, I cried, I was mad, and now I'm just fuck it,
Absolute worst part about having health insurance in America is that your health insurance company literally is holding your life hostage. Yet somehow this is deemed as acceptable. My health insurance company is continuing to hold me hostage, and there is nothing I can do about it. And what I mean by this is I need spine surgery. My insurance is continuing to deny me. What this means is that I cannot move on with my life now. I'm so disabled from my back problems, I cannot move on in my life until I get surgery. I wanted to go back to school. That's off the table. I can't be the type of mom that I want to be because I'm in so much pain all the time and I'm very physically limited. The saddest part about this whole thing is that I cannot have any more kids until I get spine surgery. My back is just too weak. I would not physically be able to hold another pregnancy. I'm stuck at home so much. I can't go out and do normal things. I can't travel. I'm missing family members' weddings. I'm missing events. There is so much that I want to do, but I just can't because my health insurance company is holding me hostage. And they're getting away with it.
My husband got his appendix out a year ago-ish. What happened was we get this freaking $20,000 bill. I was like, since when, if you have health insurance, is a surgery 20 grand? Surgery's expensive, but for an appendix surgery and we have insurance? No freaking way. We pull up the bill and we find out the insurance is sorry guys, we can't help you pay for any of this because appendicitis is a pre-existing condition. A pre-existing condition. Do you know what appendicitis is? Have you ever heard of it before? Because once you get appendicitis, you got limited time before you got to get that baby out. People aren't out here living with appendicitis for years on end. What? First of all, my man's had your insurance for almost a year before he started getting a pain in his stomach. One day, his stomach started hurting, so we went to the freaking doctor, and they ran a test, and they're like, oh, you gotta take your appendix out. Took it out. Pre-existing condition? Nah, man. Of course we appealed it, right? We're waiting out. We're giving them their 90 days to decide if they're gonna help us or not. But really?
So I work in primary care as a PCP, and I just wanted to share with you all a story about insurance. So I had a patient come in who the night before had slammed her finger in a
door hinge and had to go to the emergency department. And the emergency department told her that it's an open fracture. And if you don't know, that means that the bone has come through the skin, so the bone is sticking out. It's an open fracture and you need to see a hand surgeon, hand specialist immediately. And they wrapped her up and stabilized it and washed out the wound and gave her antibiotics. And, this is very reasonable. In order to see a hand specialist, she has to come through me, her PCP, due to the type of insurance that she has. She has an HMO insurance. And so she has to come through me to see the hand specialist. So she makes an appointment and she tells me what happens. And I'm like, oh my gosh, let me refer you right away. This is crazy. And so I put in the referral urgent referral to hand surgery with the diagnosis of an open fracture, and emphasize that it was fairly urgent. Her bone is sticking out. And it takes 2 days for the insurance company to respond. Meanwhile, the patient is trying to make an appointment, but she can't because there's no authorization. And the authorization or the referral was denied because I didn't specify whether it was the right or left hand.
About to walk in for my yearly physical, aka waste my fucking time for probably an hour and 45 minutes for literally nothing, to pay a $55 copay along with my $550 insurance every month. Do it just because I feel like I pay all this money, so I should probably use my insurance, but really it's such a fucking scam and a waste of time.
Okay, so I got married May 24th, a few weeks ago. And 2 days before that, I ended up in the emergency room because I had an anxiety attack. So nothing was wrong. All they did was give me fluids, anxiety meds, did some blood work, checked my pee, checked I wasn't pregnant, and sent me on my way. The lady was like, oh, your copay's $250. We'll just mail you because, obviously I told them my wedding was in 2 days. And they're like, don't worry about this, whatever. So tell me why I just got my bill. So tell me why my fucking bill is $1,424.96. Actually, it was $4,467. And instead of having just my copay, I owe them $1,400 for a visit that was less than 2 hours. And I have health insurance. This is with my insurance. And then people wonder why no one goes to the doctor, no one goes to the hospital, and people are just fucking dropping dead and dying because who the fuck has $1,400 laying around to get some blood work and have a doctor tell them that you're fine and you're actually not dying? I'm not paying that shit, but this is America, right? Cigna, I need you to do fucking better.
So I got my dental refund a couple weeks ago, I think, and I did a whole bunch of stories on that and what happened. But I did eventually get my dental refund after 3 months of trying, which was excellent. But I got a letter in the mail from my dental insurance company about my grievance submission, and I guess this is a copy of the letter that they sent to the dental office, so I wanted to read it to you because it's kind of spicy. It says, Dear Naomi, this is a letter follow-up to your correspondence requesting the review of services rendered and billed by dental office, a PPO provider with our dental program. After a review of the information submitted, it was determined that the office owes you a refund of $106.40, which I had been saying, and actually they gave me a check of $106.80. So they did their math wrong. They gave me 40 cents too much, but whatever, it's fine. A review of the claims submitted by their office for the date of July 23rd and the 31st, 2024 indicates the proper write-offs were not applied to the patient portion responsibility. Below is a summary of these claims submitted by their office on your behalf. We have asked them to provide a refund to you within 10 business days of receipt of this request. Please also follow up with the dental office to inquire. Sincerely, Grievance and Appeals Department. So I just want to say that I had been fighting 3 months to get this like $100 refund. And somebody finally told me when I called my insurance company and decided to ask them what to do, somebody told me to file a grievance and that would prompt the office to send me the refund. So this is my message to you. If your dental office, whatever healthcare, owes you money and they're not giving it to you for whatever reason, they're being lazy about it, file a grievance. File a grievance. Because the moment that I filed the grievance, I got my check that same week. I also posted a bad review on Google. But I think that it's the grievance submission that really pushed them to do it. So call your insurance company, figure out how to file a grievance. I just submitted mine online. It was really easy. And yeah, good luck.
I was today's years old when I found out that the government charges you a fine if you don't have health insurance, even if you can't afford it. I found this out because I was doing my taxes yesterday and the question of did I have health insurance last year came up. And I told them I had health insurance halfway into the year, but then when I graduated, I was no longer eligible to stay on my dad's military veteran plan, and if I wanted to stay on it, it would have to be a different one, and it was way too expensive. At 22, 23, I couldn't afford that. And then I told them that, yeah, I couldn't afford it because I looked into Covered California and it said I was not qualified for Medi-Cal, even though I only make like $31,000 a year in the state of California, which is literally like nothing. I told them that the calculator on Medi-Cal makes you put in your income before taxes are taken out, which I don't get to take all that home with me, so that doesn't make sense to me. And so I wasn't eligible for Medi-Cal because of that. And then I looked into Covered California, but then the plans that financially make sense and are the cheapest and most affordable over time cost more money per month. Sorry, I don't have $200, $300, $400 a month just to spend on healthcare and still need to pay co-pays, co-insurances, and meet a deductible. And the cheap plans, the ones that are like $100 or less, those plans, you don't get any coverage. That's literally getting liability car insurance, but for your health. In the long run, I knew that with the cheaper plans that I was going to have to pay more out of pocket over time if I actually needed the service. So if I'm not going to the doctor, then why even waste the $100 or less per month on something I'm not going to even use? So that was my logic. And the other thing that is unfortunate is that I've had full-time work, but between 2 different jobs for the last couple years, and so I haven't been able to get insurance that way. Not gonna lie, not having health insurance is terrifying, and it really changes the way that I approach certain things in life to avoid needing to go to the hospital. But I was mind blown when I found out that if I don't get health insurance this year, I'm gonna have to probably pay $850 or more to the government. And now I'm trying to figure out, is the government fine more expensive or cheaper than the actual cost of having insurance all year round? As a low income person, I really find this very frustrating because what makes the government think that someone who cannot afford health insurance can afford this fee just like that? Like, it makes no sense to me. And it's just one of those things where the government really is against low income people. So yeah, this is your sign to get health insurance so you don't get charged the fine that you can't afford, even though you can't afford health insurance.
Health insurance has become a source of stress instead of support. Bills increase with barely any notice, and even after paying thousands each year, coverage often falls short. Imagine being told a procedure is approved, only to have your claim denied after surgery. Now you're stuck with the full bill. Or being prescribed a life-saving medication by your doctor, only to have your insurer refuse to pay for it. Some are denied critical surgeries like spine operation that could change their future, allowing them to have children or return back to school because insurance won't recognize the urgency. Others are falsely accused of having pre-existing conditions they've never had just to avoid covering care. When emergencies arise, responses are painfully slow. The system feels rigged, and for many, the only way to be heard is by filing a grievance. It shouldn't take a fight to get the help you already paid for. That's it for today, guys. Kindly like and comment in the comment section down below. Until next time, take care.